Based on my analysis of various trends, I have distilled 5 key themes which I believe are critical for India as we move into the next phase of our fight against COVID. First, our focus must shift to Tier 2, Tier 3 cities and towns while remaining cautious about the possibility of a second wave in the large metropolitan cities. Given that the health infrastructure in smaller urban centers could get stressed relatively more quickly compared to the large metros, containing COVID spread has to remain an important goal in these areas. Additionally, we need to ramp up the number of isolation beds, oxygen supported beds, as well as ICU beds in these smaller towns and cities. Second, there are concerns about the infection now moving into rural areas, which are valid. Physical distancing, however, is somewhat more natural in these areas compared to our densely populated urban centers. We can therefore expect that the infection should not spread as rapidly in our villages. However, we cannot afford to be complacent. Some states have developed models for managing the return of migrant workers and others to villages through panchayat level quarantine centers. We need to customize and replicate these models. We also need to undertake large-scale awareness campaigns in rural areas in collaboration with Gram Panchayats through mobilization of self-help groups, as well as by leveraging the local communication channels such as community radios. Third, the most important metric we need to monitor when it comes to testing is the daily test positivity rate, which is the number of people found to be COVID positive out of the total daily pool of samples tested. We must ensure that this number comes to below 5% in all our states as per the World Health Organization recommendation. Also, states must be conscious of the fact that while rapid antigen testing is an important part of the overall public health strategy, for reaching large numbers of people in a relatively short span of time, the approach does have its limitations. Therefore, individuals who have COVID-like symptoms should be tested again using RT-PCR, even if their rapid antigen test results have come out to be negative. Fourth, while the fatality rate at the all India level has been falling over time, and this is good news, in some states it is much higher and intensified efforts are needed to bring it to at least below 1%, if not lower. This requires regular monitoring of individuals in home isolation, equipping them with pulse oximeters, as well as early infusion of oxygen in patients with moderate to severe symptoms. As has been evidenced by our experience in several districts, this can indeed be a life-saving intervention. Finally, but perhaps most importantly, we must address COVID fatigue. Globally, COVID is yet to show distinct signs of slowing down, and it is natural for fatigue to set in amongst health workers as well as citizens. In India too, we are increasingly witnessing signs of behavioral fatigue. With different sectors of the economy now opening up, employers must ensure that standard operating procedures are adhered to at places of work. States must also pay greater attention to health worker fatigue by ensuring rotation of shifts and allowing adequate time for rest. And for all of us, while we do need to get on with our lives without fear, we must continue to follow the necessary precautions, because while we might be getting tired of the pandemic is not tired of us just yet.